Good afternoon, Hampton Roads. Kenny Golden here, and you're listening to Hampton Roads Defense, and we've got a great show for you today. We've got two guests, and we're going to be talking about hyperbaric oxygen. And the reason we're talking about that is because of the work that's being done with veterans here in the Hampton Roads area. And veterans, hopefully, this is the kind of therapy that'll catch up and catch on throughout the nation. So it's something that I think is very, very important. And the reason we're talking about it in the realm of defense is because of what's being done with veterans. So I have two special guests here. I have Cara Mae Melton, and she is from America's Mighty Warriors. And I have Sarah Stolman, who is here from Hyperbaric Therapy of Hampton Roads. Or I guess it's Hampton Roads Hyperbaric Therapy.
Yes.
So good morning, ladies, and welcome.
Good morning. Thank you for having us.
Oh, it's great to have you here. The reason that I have you here, and I'll tell the story to the folks. In 2005, I had throat cancer, and I had been offered a job in Washington, D.C., but I had to go through all the machinations of chemotherapy and radiation and all that stuff. So they agreed to keep me up there in a limited space and a limited time while I was going through some of the healing. And part of the healing process, turns out, was hyperbaric oxygen. And the reason for that was what we were trying to do was save the back teeth that had been radiated. And, of course, I'm sitting here right now with a healthy set of back teeth and that they wanted to pull, and I'm glad I didn't do that. So I really think it works. And I wanted to have both of you on to talk about what's going on with the veterans and to talk about hyperbaric oxygen treatment, what it is, and so people will understand what it is. So why don't we do that first? So who's going to talk about that first? Sarah, are you going to talk about that?
I'm sure. I'll talk about hyperbaric therapy. Hyperbaric oxygen has been around since the 1600s. It originally was used for divers with the bends or decompression sickness, and it involves being under pressure, simulated 15 to 50 feet below sea level. When a diver would get the bends, because he wasn't decompressing properly, he would be recompressed in the chamber in order to allow the nitrogen bubbles to leave the body. Now it is used all over the world, and it is in almost every hospital in the United States. There's 14 indications that are covered by insurance. That includes osteoradionecrosis, carbon monoxide poisoning, gas gangrene, diabetic ulcers, a lot of non-healing wounds. And so what we do here at Hampton Roads Hyperbaric Therapy is we treat a lot of things that are not yet approved by the FDA but have been shown internationally in the last 60 years in studies and research to show improvement. So hyperbaric therapy consists of breathing 100% oxygen under pressure. You and I right now are breathing 21% oxygen. If we were to breathe 100% oxygen right now, it would only go through the bloodstream. But being under pressure forces that oxygen to dissolve into all of the tissue, the muscles, the bone, and promote healing. It helps with growing new blood vessels, healing damaged nerve endings, and replenishing blood flow that has been knocked out in certain areas of the body and the brain. So when someone gets a concussion or a traumatic brain injury, there's a part of the brain that knocks out the blood flow, and a lot of people think that when you have a brain injury, that damaged tissue is all dead, when that's not correct at all. Some of it may be dead, but most of it is just sitting there idling, and it doesn't have enough oxygen. So being under pressure forces it to kickstart and rejuvenate the damaged tissue in the brain.
If you don't know anything about this, I think it's something that you should research. So one of the things that I want you ladies to do is both of you, and Sarah, why don't you start off, is give us all the details for your office and how someone could get in touch with you here. We want to do that in the first segment and also in the last segment. So give us all the details.
So you can visit our website at hrhyperbarictherapy.com. We also have a Facebook account and a Twitter account to follow us, but you can also call 757-622-1919 and get a hold of us that way. We'll be there to answer any questions that you have. Some of the indications that we treat that have been shown successful are chronic fatigue, concussion, post-concussion syndrome, fibromyalgia, fractures, any kind of head injury, stroke, heavy metal poisoning, infections, inflammation, migraine, mold exposures, multiple sclerosis, Parkinson's disease, peripheral neuropathy, and any kind of chronic pain or crush injury. Now, a lot of the hospitals in the area, they will only treat the approved indications. So we at Hampton Roads Hyperbaric Therapy, we do not actually treat the approved indications. We only treat the things that have been shown internationally. But you can call and we can set up our consultations with our medical director are always free. So you're welcome to come out and ask any questions that you may have to see if you can benefit from this treatment.
Now, do you have a group of patients that are willing to talk to people about this?
Yes, and we also have a testimonials page on our website where we videotape our patients in the middle and after their treatments explaining how it has helped them, and they're always here to talk to people who, if you see someone on the website who has the same indication that you're interested in getting treatment for, they're always more than willing to talk to you about their experience.
Well, I remember up in Mount Vernon, the hospital, there was a bell, like a ship's bell. It wasn't a big bell, but Navy guys are all used to bells, and this bell would set out in the lobby, and there'd be 10 or 12 people there because they had 2 different rooms with 4 of the chambers. So there was quite a few people waiting there to go in the chambers, and but there was a bell, and if you were healed or designated as being healed, you would go up and ring the bell. And the bell was rung. I went through the treatment for about, I think at least 2 months. And I remember the bell being rung 3 times while I was there. And most of the patients that were in there were diabetic. And they had some type of diabetic injury. The foot, toes, and that kind of stuff were having problems healing. And they were healed by this treatment, and they would ring the bell as they went out, which I thought was really kind of neat.
Yeah, it's really neat. It really does help prevent the need for amputation. So it's been great in diabetic ulcers that have not been able to heal for even up to 2 years. And so when the doctor says, we're looking at amputation, they throw in the hyperbaric, and that's been able to help prevent 80% of the people from getting amputation.
Well, go back over that list again. I want you to read that list again.
Okay. So some of the they're considered off-label indications, which means they're not yet approved by the FDA. And that is autism, cerebral palsy, chronic fatigue, concussion and post-concussion syndrome, fibromyalgia, fractures, head injuries, stroke, heavy metal poisoning, infections, inflammation, immune deficiency diseases like Crohn's and inflammatory bowel disease.
Yeah, that's what Crohn's is, yeah.
Yes. Mold exposure, migraines, multiple sclerosis, early onset of Parkinson's disease, peripheral neuropathy, post-shingles, post-traumatic encephalopathy, pre- and post-surgery, and any kind of crush injury.
I mean, that is an incredible list. When we were talking the other day, we didn't say that, but that's a list of a lot of things that people have. Well, I want to talk to Kara about what you're doing with the veterans, and that's why you're here on the Hampton Roads Defense show. But I think it's important. And of course, when I was over the other day, one of my former Navy buddies, Ron, I'm not going to mention his last name, he was over there, and he's being treated for a stroke, right?
Yes.
So, and he already has seen some progress, and where there was no progress before, I can tell you right now there was no progress. And I can also tell you that his speech is, well, I didn't notice any problem with his speech, but you could doggone sure notice that there was a problem with his speech after that.
Yes, and his stroke is actually almost 8 years old, so a lot of people think, well, I had this injury a long time ago, so it's not going to help me, but it doesn't matter how old the injury it is.
Yeah.
Obviously, the earlier the better.
Right.
But I also forgot to mention that we do have a foundation at Hampton Roads Hyperbaric Therapy called Hyperbaric Hope.
Okay.
And that. Yeah.
Good. Well, what we'll do is we'll let Larry take us on a break here, and when we come back, Cara, we'll talk about what we're doing with veterans.
Sounds great.
Ladies and gentlemen, you listen to Hampton Roads Defense. We'll be right back. Good afternoon, Hampton Roads. You're listening to Hampton Roads Defense with Kenny Golden, and I am real privileged to have folks here talking about hyperbaric oxygen treatment. And you'll say, well, what's that got to do with veterans? Well, you're just about ready to find out, as Cara Mae Melton is going to come on and talk to us about some of the work that's being done with veterans here in Hampton Roads and how important it is. And I am a big believer in hyperbaric oxygen treatment. I saw what it did for me and how much better it made me feel and how much quicker it allowed me to come back from some pretty doggone devastating cancer treatment. I went from, I'm a 240-pound guy, 6'2", and I was down to 162 pounds, and I was right back up in about at a decent weight in about a month and a half, 2 months. So it really makes a difference, and I really credit that to the hyperbaric oxygen treatment. So, Cara, tell me what's going on with the veterans and how you work through the system to make that work for them.
Sure. Well, America's Mighty Warriors has been around since '06. It was started by Debbie Lee after her son Mark Lee was the first SEAL killed in Iraq. And since then, she's dedicated her life and America's Mighty Warriors mission to honoring the sacrifices of the troops, the families of the fallen, and our vets. And typically the organization had two main programs, advocacy and also Gold Star Respite. And recently, it became apparent to us that there was a huge need, especially here in Hampton Roads, for our troops, our service members, and for our vets to get help and treatment for mild traumatic brain injury and post-concussion syndrome. We realized that a lot of our vets and troops are suffering from acute blast or multiple blast injuries and don't even understand that they have a traumatic brain injury. And so what's happening is they are going through all of these symptoms that are literally changing their lives and changing the lives of their family members, and they're not being adequately treated. The symptoms include things like depression, anxiety, insomnia, anger, the inability to have patience. They want to withdraw from their families, from society. And what's happening is they're getting a bunch of pills. You can't sleep, here's a pill. You're depressed, here's a pill. You have anxiety, here's a pill.
Yeah.
And they're not even aware that there is a treatment out there to actually help heal the actual brain injury. And when we found out about that at America's Mighty Warriors, we said, gosh, we have to step in. And then when we found out more that this treatment is not covered by insurance, it's not covered by the VA, and the military is not offering it, we said, we have to do something. And so we formed a program recently called GOT HBOT. And the purpose of this program is to create awareness about and funding for hyperbaric oxygen treatment for our service members and vets with mild traumatic brain injury and post-concussion syndrome.
How about just PTSD? I mean, the actual being someone who's been designated or diagnosed. I mean, they may not have a brain injury, but because of going over there having PTSD, I mean, and there are people that are clinically diagnosed as PTSD patients.
There are many people. And I am not a medical expert, but I can tell you that through the research and talking with a lot of doctors, what we're finding is that a lot of these symptoms overlap. The symptoms from the injury, the actual brain injury, and then the PTSD overlap. And so though we're not saying that HBOT, hyperbaric oxygen treatment, directly heals PTSD, we can say that it helps alleviate a lot of those symptoms that overlap with the traumatic brain injuries and those same type of symptoms that I talked about, the depression, the anxiety, the headaches. Headaches is a big one, the insomnia, those types of things. So a lot of times PTSD is being diagnosed when there is a brain injury on top of that or vice versa. So I think that a lot of clinics around the country are treating and people are finding relief when they do have PTSD, but we're just really careful about saying that it heals PTSD. There's an emotional component to that too that it's important that people address.
Is there anybody doing any kind of studies on it at all? I mean, is there anybody out there that like Duke University or somebody that does a lot of studies. Is there anybody out there doing studies on hyperbaric oxygen and treatment of some of these things for veterans? Is anybody talking about it at all?
There are more and more people are talking about it. I'll tell you honestly, certainly not enough, but more and more people are talking about it. There was a survey, a study done in Israel that was published in November, and Sarah could probably talk a little bit more about that if you want to just jump in.
Yeah, the Israel study was published in November and showing that it is helping with post-concussion syndrome, and it talks about the protocol that we use and that many of the off-label clinics around the country are using. There's been a couple other studies that have been published, but they're being used at the wrong protocol and they're not showing the benefits that are shown at
Well,
the
the
right
Israeli
protocol.
study, can you get your hands on that? I mean, could you put it on your website and maybe
Yes.
have a link to it?
Yes.
Is it on the website?
Yes, it is. It's
So
under
it is
our
on the
research
website.
page. Yes.
Ooh, that's good.
Yes.
That is good information.
Yeah.
So, the next step is to try to get the VA involved, I think. Because there's so many things that, we're trying to get the VA involved in. I know I'm trying to get them involved in just the Honor and Remember flag, and it's so very, very hard to get a shot with that. But this to me is something that we ought to be pushing them to get our veterans.
Yes, it really is. There are a lot of people trying to do that right now, and we certainly are ready, willing, and able to join that fight. But we also realize that we can't wait for that to happen. And that's why America's Mighty Warriors is stepping in now, because we can't wait until insurance does cover it, and we can't wait until the VA picks it up. We'll be fighting that fight, but in the meantime, we need to get our folks treatment. And so we'll be going to the local companies and local donors to help get our vets and the troops' families' lives back. And so we really want to create that awareness and get as many people as possible to understand that this is something out there that can help. We hear this all the time. There are vets and active duty service members that have been injured just saying, well, you know what? This is how I am now. This is just the way I have to live.
Take a Xanax.
Yeah.
That's the thing that kills me is the cure for a lot of these things is the pills that you brought up. And I, having experience with Xanax, I was given that for something, and I took one, and I said, my gosh, never again. I'll never take that drug again, ever. Because, it makes you into a zombie.
Right.
Matter of fact, if I was going to go in the role of, on the television show Walking Dead, I think I would take a Xanax before I'd figure out a way to make my teeth click together and make that high-pitched squeal. But, I think I'd start off with a Xanax because it just drives you just right down to the ground. There's nothing there. And so I guess, that's the cure. But this, for me, I can tell you I felt better. I know the healing was much faster because I saw the ability just to physically do work. When you're poisoned by radiation and chemotherapy, you're weak, and the ability to be able to come back and physically move stuff like furniture, bring stuff into the house, a box of clothes, or just, when I first went back up to my home in Manassas, and I was up there by myself, Francie was back down here, just moving the clothes into the house to get ready to go to work took me 2 days.
Right.
And in probably a month, I was back to moving sofas around, and that's just a dramatic difference for one person that had the type of problems that I had. So you can imagine what it would be, and I did. I noticed a difference in Ron when I was talking to him the other day.
Did you?
Particularly in the speech, and of course for him it was the ability. He has some feeling and a little bit of movement, and that's on one side, which he didn't have any before. None, zero. So it makes a huge, huge difference. So what we're going to do in the next segment, I think, is we're going to call a veteran and have him get on the radio here and tell you his experience with it. So I think that's going to be real important. The other thing that I think is important is the fact that there are just not that many places that do this.
No,
I
not
had
at
to
all.
search for this, and the searching, I try to remember, it came up when I was talking to the dentist about pulling teeth and about healing, and one of them talked about hyperbaric oxygen, and I think that's where we got the idea from, and so we looked it up, and we found out that it was authorized for the post-cancer treatment, and so that's how I found out about it. So.
Right.
The more we can tell people about it, but if there's not that many places here in Hampton Roads, it's important that they know about it. So
It is. This is the only place here that will treat for these types of, as Sarah said.
Is there anybody else that
off-label.
does that,
There's
hyperbaric
one other
oxygen?
person in Virginia and Reston, but we're the only one in the state other than Reston, Virginia, doing it. There are some other clinics, and in every state there's probably about one or two different clinics. Some have way more, and I'm in contact with a lot of them, so I can help people that are looking in different states as well.
Good afternoon, Hampton Roads. Kenny Golden here, Hampton Roads Defense, and we've been talking about hyperbaric oxygen. And I've got two great friends here, Cara Mae Milton from America's Mighty Warriors and Sarah Stoltman from Hampton Roads Hyperbaric Therapy. And what we thought we'd do was give you folks a testimonial of how hyperbaric oxygen works. And I've got a gent that they know and real excited about on the line now. Tom, how are you today?
I'm wonderful. How about yourself?
We're doing great here. We're looking at downtown Norfolk here. I can actually see the national terminal over here from where I'm sitting. I'm up on the third floor of the Crown Plaza Hotel in a new studio that we've got up here. So we're excited about having you on today. Take us through, what actually happened to you, what caused you to have an injury, and take us through the whole thing, if you would.
I spent numerous years in the U.S. Navy. I was in a blast in 1981 that caused a traumatic brain injury. I've also suffered from PTSD over the years as a result of that, and a few other things I've done.
Well, now, what was your rating in the Navy? What did you do?
I was a CB. I was a construction mechanic.
Okay, gotcha. CBs can do.
Yep, sure can. Or also known as a Marine with a driver's license.
Well, I'll tell you a short story. I got a buddy that was a CB in Vietnam, and I teased him by calling him Boats. He hates that, so I'm not going to call you Boats. So,
Thanks.
tell us. So, actually, tell us what actually happened to you. I mean, it was an explosion that caused you brain damage. Is that what happened to you?
Essentially, yes.
Okay.
Really don't go into great detail on it. The PTSD kind of prevents me from wanting to really go into huge detail.
Understand.
Apologize for that.
Well, tell us about your experience with hyperbaric oxygen. How did you hear about it?
Actually, on Facebook, I was talking to somebody on a site called Stop Soldier Suicide, and I was talking about PTSD, and the young lady there said, "I think I can help you." And she put me together with Sarah, and Sarah and her worked it out. I'm doing 40 treatments. I think I'm on number 17 right now.
They're shaking their heads saying yes.
When I started, initially my afflic was flat. I am a very closed person. I have very few close friends. I'm very tight with my defenses about myself. I don't go to movies. I don't go out in public. I don't go to concerts. I have very limited social exposure.
Well, now, is this a result of what happened to you, or were you like that before? I mean, is this, what has been your experience, since you started the treatment, and, has it made a big difference to you?
I was never like this prior to the military. I was involved in forensics in high school. I took A's for many years in state competitions. I spoke publicly. I did a lot of public-orientated things. After my injury and after the PTSD, all of a sudden I closed up. Going to Sarah's, I initially, to be honest with you, when I started hyperbaric, I thought, well, it might be the emperor's new clothes, and I may get nothing out of it. But then again, if I don't try, how will I know? Surprisingly enough, I'm this far into it. My girlfriend sees a great deal of difference in me.
Well, that's good.
My friends, what few friends I have seen a difference, and I actually feel a difference. I'm not quite as morose, we'll say.
What did you experience the first time you actually had a treatment? Was it dynamic? It was for me, I can tell you that.
To be honest with you, I wasn't sure. It actually took me about 3 treatments before I realized that, hey, this might be helping. I was uncomfortable, I can tell you that. I initially sweat out toxins and everything else, and I've had surgeries and I've had other things over the last few years. And I swear I sweat out more of the anesthetic than I did anything else the first 2 trips in.
Probably so. Well, now, did he? I'm looking at them now. Did he have to wear the hood?
Yes.
So that probably made you uncomfortable. That hood. I know that would make anybody who had claustrophobia would probably make them uncomfortable to wear the hood.
I'm not claustrophobic. I used to certify tanks, vessels, so I used to climb into fuel tanks and tight spaces all the time. That never really bothered me. So being in the tube actually is wide open spaces for me.
Yeah, I can imagine.
A lot of people will notice some kind of detox the first couple treatments as well, whether it's sweating a lot or their digestive tract is a little bit funny or their breakout on their face. I know that happens to me if I haven't gone in a while. But
Really?
after a few treatments, they're done sweating. They feel better. So I've noticed that with a lot of my patients. It's just kind of like a detox. It's pushing a lot of the toxins out of the body.
Well, tell me about how you feel now, Tom.
My mood is much better. I don't have as sudden of mood swings. I would have, how do I explain it? I would have very sudden mood changes. My mood would change minute to minute. You never knew exactly where I was at. People would feel like I was going to explode any moment. Really, I'm a fairly quiet person, so they never really knew what my mood was. But besides that, my nightmares have reduced a great deal. I have some really interesting epic dreams, but my nightmares have gone way down. My sense of security around people has gone up.
Well, now, in the actual accident that you had, did it cause you to have physical damage as well? I mean, were you injured physically in the blast as well as the head trauma?
I was unconscious for 6 weeks.
Unconscious for 6 weeks. And what kind of other injuries did you sustain?
At that point in time, I had broken both collarbones. I broke the eye orbits in both eyes, my cheekbones, my nose, and my jaw.
Okay. And have you noticed, has it made an improvement in your physical ability? Did you notice that it's helped you with that, particularly like in the jaw, for example? I would think that would make a difference with the hyperbaric oxygen. Have you noticed any change there, or has it just been in the mood that you've been able to your personality has come back because of this treatment, from what I hear, from what you're saying?
Right. Well, I don't have as much facial pain. I've got a very high pain tolerance because over the years I've learned to just shut it off. I avoid pain medication. I don't want to become addicted.
Right.
I notice that the pain in the edges of my eye orbits, my headaches have diminished greatly. Matter of fact, I can't really recall last time I had a migraine since I started this.
Wow,
That's been broken numerous times. I boxed in high school. I did a little bit of boxing while I was active duty, and I've noticed that my thinking's a lot clearer. You get your brain jarred enough times, things happen to you.
Yeah,
I mean,
yeah.
you start feeling like you've got wool over your eyes a little bit. You know what I mean? Just a little hinky.
Well, one of the things that in the reading, and we were talking about this, is the fact that, and there's no study to prove this right now that we know of, but one of the things that I've read a couple times is the fact that it helps to grow or expand capillaries. And if that's true, you would understand why it would help someone like you, particularly in something like migraine headaches. That would make a big difference. And you're a victim of that because of the explosion. And I know I've got some family members that have that. So, and I didn't realize until we started reading off the list of maladies this will help with that it actually helps with that. So, you personally experienced that, correct?
Yeah. Well, I've noticed more sensation in my hands, my feet, other parts of my body that I think the capillaries have just closed. I mean, as you get older, things get plugged up anyway, and I can't not imagine it's fixing things within the brain as well. From what I've read and what I've studied over the years, a brain injury is essentially a piece of scar tissue inside your brain. It blocks access from one side or the other of the synapses. This seems to allow a little more transfer of information. My memories from about fourth grade until after I was injured were very, very disorientated. I had no sense of timeline. Now I'm starting to regain that to a certain extent. So I think, capillaries, I believe it's doing deep healing on the tissues.
Yeah. Well, what you're telling me makes me feel good because it seems like it would help people that are stroke victims. And the guy that we were talking about is a friend of mine that is a patient for Sarah and Cara, and he's had a pretty severe stroke. His entire right side was damaged. So, well, look, we are coming up on 1 minute, and I just want to thank you so much for coming on and giving your testimonial. And good afternoon, Hampton Roads. This is the last segment of the show we're doing here today on hyperbaric oxygen treatment. And again, I want to emphasize that the reason that we're talking about it is because it is such an important thing for veterans. And we feel that, and I'm talking about the guests that I have today, myself and my two guests, Cara Mae Melton from America's Mighty Warriors and Sarah Stoltman from Hampton Roads Hyperbaric Therapy. They're here today to talk about hyperbaric oxygen, or what Cara says is HBOT. So if you see that, if you see a bumper sticker on a car that says GOT HBOT, they're talking about hyperbaric oxygen treatment. And we just had Tom on to give a testimonial about his treatment. He's a Navy veteran who was caught in an explosion and suffered a pretty traumatic brain injury and some other injuries. Obviously, the injury was to the upper body and to his head, and he's seen some dramatic results in 17 treatments, and he's got, I guess the treatment is out to 40, right? Cara, is that what we talked about?
Yes.
So we were talking in the break about the advantages of this and the fact that, and the thing that I like so much is, rather than take a pill and resign yourself to the fact that I'm going to be like this for the rest of my life, this treatment is a possibility that can help you. It's not going to make you perfect, and the injury may always be there, but it's a possibility that it may move you back closer to what you used to be, and that's what I like about it.
That's a really good way to put it. It's not that this is magic and all of a sudden people will be returned to the exact version of their former selves before injury. You do have to be realistic about that, but it has given so many people encouragement and hope. People that thought that this is it. Now my life is mediocre. I'm never going to be the way I was, and things are just okay. And if I can just keep my head above water, well, I guess that's all I'm going to have to do. And Sarah has had so much experience. with so many vets that have come in despondent, depressed, really not believing that this was going to help them because they have tried everything else and nothing else helped. So they figured, why would this be any different? And then after treatments, even as few as 10 treatments, they're coming in smiling for the first time. People are able to drive when they weren't even able to drive. People are sleeping at night, holding down jobs. I mean, Sarah, you can talk all about it. It's
Yeah,
amazing.
and one of the things I want to emphasize is the fact that you guys have only been in existence for, what, about a year, right?
Yes, that's correct.
And how many vets do you think you treated in that year?
I've only treated a couple vets in that year, but in my career of doing hyperbarics, I want to say that I've treated close to 100. And it's always the same when they come in. They're dependent on drugs. They have migraines. They can't hold a job. They're fighting with their spouse constantly, saying, why should I be here? I've done everything else. And you see them every day. They come in, and you start to see them smiling when they come in. Their mood's better, and wow, I actually went a whole day without a headache for the first time in I don't know how many years. I actually slept all night long, and it just continues. They continue to improve.
Did you notice that Tom talked about the fact that he doesn't have nightmares, but he has epic dreams? To me, that was kind of that was a dramatic statement for me, because when you have trouble sleeping, your dreams are not good. And I remember when I had what do you call it? Not where you stop breathing, sleep apnea. I don't have that anymore, thank goodness, because of the way I sleep and some other things. But when you have sleep apnea, your dreams are always they're just not good dreams, And he's saying he's had some epic dreams now rather than nightmares. So to me, that was a dramatic statement from him.
Yes, I actually have a lot of my patients say that, and they would say, I never really felt like I dreamt. I can never remember any of my dreams, but even after one treatment, they say, oh my gosh, I have some very interesting dreams last night. And they continue to have those dreams. And